platinum pearls in general surgery, super specialties. And this was a project which took quite a considerable amount of time. And this project, as far as NEET MCH students are concerned, the aspirants for the MCH, the MS surgeons who just want to go into different branches of surgical specialities. And this was, I would say, an incredible effort from the team, from myself included. So, as far as this project is concerned, we are well aware of the fact that we have got the Platinum Pearls, the Platinum Series, as far as NEET PG is concerned, FMG is concerned, and the super specialties are concerned. So, what this, I mean, say, this book, the concept of the super specialty book is there. We have got the things and well sorted out because you need for this project what you needed to have all the contents, I mean to say, what is asked frequently, what is always on the mind of an examiner, what are the topics which are there. And as far as I will just run you through the topics, the contents which are there, you can see that we started from surgical anatomy and going from surgical anatomy to, I would say, all the branches over there, the musculoskeletal, the vascular, thoracic, urology, head and neck, neuro, endocrine, pediatric, plastic, image based, and we did not leave any part untouched. That's very important. A book has to be very compact as far as taking the needs of the students are concerned. This is not a UG project. This is not an MBBS book. This is not a, I would say, a static anatomy book. And this is something in which you have to incorporate the clinical cases, the clinical scenarios. The standard has to be super specialty level, and you have to have all the correlation, the genetics, the pathology, the surgical concentrations, the clinical presentations, the lab values matching the clinical entity. And as far as our experience from the previous examinations is concerned, we have taken into account, I mean to say, the views of the toppers who just have appeared in the examination, what they found. Now, as far as this book is concerned, we took into account everything. I would say all aspects, all regions, from an anatomical perspective, upper limb, lower limb, thorax, abdomen, and from a surgical perspective, I mean to say the abdominal surgery, the head and neck surgery, the plastic and reconstructive surgery. I mean to say other aspects like the endocrine surgery, the surgical oncology, the neurosurgery, the head and neck I mentioned already. See all the dimensions which are there. And what is important, we did not restrict ourselves to only, I mean to say, the questions which have been previously asked. What is important is that what is in the mind of the examiners, what are the future trends, what is important as far as our expectations from the next 2027 examinations are concerned. Everywhere we see that there are some topics which tend to be high yield topics. Say I give an example of we take any, as you mentioned, neurosurgery. As far as neurosurgery is concerned, we have got this, say, brain tumors, I mean to say, medulloblastoma, craniopharyngioma, glioblastoma, I mean to say, prolactinomas. So, how do you frame a question? How do you differentiate these things, even from a pathological perspective, even from a genetic perspective? So, that is very important because we have seen that the concept of examinations is changing. They are not looking into one liners, they are not looking into memory based questions now. They are looking more into the pathogenesis of the disease, even in surgery. Here, I'm not talking about DM. They are looking into the genetic aspects, the chromosomal involvements of the disease, and then the concept which should be there as far as super specialty is concerned. So that is wherein we have placed in the pathology as well as the surgical pathology as well, giving a more emphasis on the fundamentals and supplemented the things wherever it was needed. And important thing is that what happens, this is just like we are studying for the undergraduate level. Let me tell you very frankly that most of the surgeons get these questions right as far as diagnosis is concerned. But why do they fail? They fail in the basic concepts. They may be knowing so much about how to do a laparoscopic cholecystectomy. They might be knowing how to approve, but only thing is that once they are asked the basic questions about, say for example, the blood supply of a particular organ, the particular vessel, they just do not do well in that, because the fundamental knowledge as far as the examinations like the MRCS are concerned, wherein they have part one about the MRCS basic and part two about the clinical. In here, this is a combined examination and they have to have this concept. So as far as this NEET MCH concern book is there, we have just taken into account all the modalities. We have just gone and given them a beautiful representation, image-based representation in many of the cases wherever, and in cases where they do not need to know. So as far as, for example, I focus on this page over here, so there is, you cannot find any, I must say, image-based question over here. So this is from surgical oncology, and the questions are asked in a manner, and a bulk of the questions are like this. We get a small chunk of questions on the image-based aspect, but wherever we have found the need, we have found this as a need to prepare the students for MCH vis-a-vis the concept. So that is not based on cramming, that's not based on retention, that's based simply on grabbing the concept, and because that will help them in future as well. So we have taken the future into consideration. That's very important. So as far as this book is concerned, you can see that we have got, I would say, it is designed properly. It is, I would say, a cosmetically beautiful area where I am weak. Cosmetics is something which I just focus more, but the thing is content. I tell you frankly, you can just do a lot of advertising about your content, about your matter. What is important? 0% plagiarism. 0% plagiarism is what is I always look for. That is one part. Number second, nothing copied, nothing downloaded from anywhere, all originality. What that originality does, that gives you the satisfaction. And there are people in the team who just contributed, and you can see with each and every, I will just, I would say, pinpoint this thing. You can see in case there's an image of any thing, and it is just given, it will be given with the courtesy which doctor has given that image. So that is very important. You can just see over here, it is my colleague, Professor Zubada, Professor Zubada. The image is from her, the image is original. There's no way we can just do anything wrong. So a credit is to be given the person who has contributed in a manner he or she has contributed, and that's one of the fundamental issues of originality. That gives us immense satisfaction that we have this book which is own. It is not something like a copy paste, which many of the people might be doing. I'm not aware how much they derive from that, how much satisfaction, intellectual, academic, they derive from that. I'm not sure, but surely we will not be doing the things that way. So that's very, very important as far as this. And important is content, the quality of the content. If there's a para over there and that para gives you answer to the 10 questions which might be coming ahead, that is important. You can read 20 pages and derive nothing from those 20 pages. That's not my cup of tea. That will not be the domain which I would like to go into. My things happen to be very focused, very concentrated, and I would say from a long term perspective as far as education is concerned. That's very important. And going further, I mean to say, because so many specialities, so many subjects, and then we have to look into all that. We give weightage to all the areas. We give area, we have given weightage to, I would say, to surgical oncology as much as it needed, to surgical gastroenterology as much as it needed, urology as much as it needed, and the other aspects. So as far as the revised, this is the revised edition, this is newer edition, this is a more updated edition. We have taken all the, I would say, branches into consideration: pediatric surgery, endocrine surgery, and we have not, to, I mean, say, to the best of our capability, we have just, I mean to say, come out with this thing almost 1.5 to 2 years. It has taken us to get this book out, updated, and I wish all the MS aspirants who just want to have this MCH tag after them. Best of luck in this journey. If I have somewhere helped or contributed along with my team, it would be, I mean, say, very convincing for us to see that our efforts have helped you a bit. So wish you best of luck.